The following is a special presentation of the Services Effectiveness Research Program of the Department of Psychiatry and Behavioral Sciences at Duke University Medical Center.
It helps kids to recover from if they had a hard life with their real parents before.
I had got kicked out of my house for fighting.
They have emotionally saved me and helped me out mentally and physically.
When I was with my real mom, we didn't have a bedtime or anything like that, and the way she treated us, she treated us unfairly.
You need somebody that's there for you. My foster mama, she's the person that I can talk to real good and stuff.
To me, it's all the same. Just as long as I got somewhere to lay my head down and eat, I'm fine.
Hundreds of thousands of children in the United States currently are placed in psychiatric hospitals, residential treatment facilities, juvenile detention centers, and foster care. But these settings are being replaced by intensive home and community-based services. To prevent institutional placements for kids with severe problems, a loving family is not enough. For these children, now there is a chance to get the treatment they need and to live in the community. Therapeutic foster care, also called therapeutic home, is a home-based treatment for certain emotionally traumatized or behaviorally compromised kids. These children often have a history of serious abuse or neglect. Some are depressed or anxious. Some have post-traumatic stress disorder, and many struggle with severe behavior problems. The model for this mental health approach is based on Professor Patricia Chamberlain's long-term research at the Social Learning Center in Eugene, Oregon. Oregon's success follows from strong staffing resources, intensive supervision, and a unique partnership between public child service agencies that may not exist in many other regions of the country. In North Carolina, efforts have been underway since the late 90s to study the Oregon model and adapt it to our own version of therapeutic foster care, or TFC. While public services may look different from state to state, the key principles behind TFC are the same: proactive agency supervision, well-trained parents, and an ongoing emphasis on strong relationships between parents and supervisor, as well as parents and child. Duke Associate Professor Elizabeth Farmer studies therapeutic foster care in North Carolina.
And some of those things that we've learned about are that better training for treatment parents or treatment foster parents helps to produce better outcomes for kids, that the more supervision the treatment parents get from their supervisor at the therapeutic foster care agency, the better the kids look, that the quality of the relationship that develops between the therapeutic foster parents and the child is very important for determining the outcomes that a child is likely to achieve.
Both public mental health and private agencies have responded to the challenge. Over 70 North Carolina agencies are licensed for TFC, ranging from less than 5 homes to over 200 licensed TFC homes.
It's really challenging for a lot of agencies to actually do therapeutic foster care. It's really hard to recruit parents, as is probably obvious from how difficult this is. There aren't a lot of people sitting there saying, I want to take a really difficult child into my home and live with them for a while. And so it takes a special kind of parent, and it takes a special kind of support from the agency to make it viable for the parent and the family to be able to do that.
Kids Peace is one such agency committed to the therapeutic foster care model. Jennifer Herbert is a Kids Peace family consultant.
Our agency having small caseloads and being able to go in, we're required, that's part of our contract, is that we're going to see our families at least 2 or 3 times a month in the home, and then we're going to attend their treatment team meetings. So just having that support system, I think the foster parents, especially new foster parents, it's very overwhelming. Our agency's belief is that if the foster parents have the support, that they can be more supportive to the child.
Shannon. How are you today? Good.
I just don't like it.
There's got to be a reason.
The bond between a foster treatment parent and supervisor or family consultant is forged by the frequent scheduled meetings and home visits and by 24-hour support for families. Blanche and her husband Donnie are parents to 5 children and 2 TFC children.
I've always had a passion for children. For many years I was a volunteer, so I always said at a certain point in my life that I was going to decide to be a foster parent, and we decided as a team, a husband and wife, that my desire was to do more therapeutic because I felt that was more challenging, and that was all of the kids have a need, but I felt like I was better needed in the therapeutic area. My husband and I both were qualified to work with kids with behavior issues that could arise. I think the big challenge was the unknown.
Requirements will be that we're more specific about what exactly it is that we're doing.
So are you saying this should change on his note?
No.
Okay.
Nothing changes except this is just to help you.
Even with formal training and have been a volunteer, when they're living in your home, it's totally different. You know, you have no idea what it's like behind closed doors until you're there and you're the caregiver and you're providing this day in and day out.
So that you can hear the question first and then the responses so that they can share and that you all can be thinking
In
about
addition to
yourself
support from family consultants, agency personnel and therapeutic foster parents receive extensive training on child development, approaches to self-control, communication skills and behavior management, as well as issues confronting children who have been removed from their homes.
know each other in your groups about some of your own experiences with these different areas that are covered.
Because therapeutic foster care is seen as a frontline mental health intervention and not just substitute care, therapeutic foster parents get paid accordingly with a monthly stipend based on the child's level of difficulty and other agency considerations.
Okay, the examples that we have was argumentative / disagree, ignore, withdraw, and 3 is the negative behavior. Ways of getting out of it is not to argue, ignore, or time out for self or that subject.
Why is it so important to have a supportive and involved relationship with your family consultant? How have you gone about the process of building a relationship with your child?
Well, the first thing would be that everything. Relationship has everything to do with it.
Yeah. You gotta have that trust.
Shannon and Randy are therapeutic parents to 2 TFC teenagers.
Well, I was in foster care when I was growing up, and it's just something that I've always wanted to do.
We just thought we can help. The training was a big help to us. I mean, we got CPR certified through Kids Peace. We learned about administrating medicines and suicidal deals with kids and stuff. We just learned a lot.
And she said to me that her biggest fear was when she gets married, that no one from her side of the family would come. And I thought that was really interesting. And I began to tell her, well, hey, you've got me, you've got Pops, you've got all the people that were in your life that's part of your family, and we'll come.
Special activities.
I wasn't really into it at first until I started going to the training, learning what other kids don't have that my kids do have. We've always loved children, you know, having as many as we could. And it just went from there, and the training taught us a lot. Seeing what the kids were doing without, the ones that's been really abused physically, mentally.
6 weeks of training and ongoing continuing education prepare parents to establish clear house rules and expectations. They must act early when undesirable patterns begin to emerge before a problem blows out of proportion.
When I first heard of the training, I thought, what can they give me? Of all the things I have been through over the last 3 to 4 years, there's nothing they can tell me about behavior modification that's going to help me at this point. I was very, very negative about it. I thought it's going to be too long. I'm not going to get anything out of it, and I should be teaching the class. They shouldn't be teaching me. That was my first attitude about it. After attending the training, I found it to be very thorough, very helpful.
And so I think that's his biggest fear, because he's often telling us he doesn't want to leave.
Parents are taught different ways to appreciate and acknowledge good behavior, to avoid power struggles, and to maintain rules with frequent, small but meaningful consequences. Through these interactions, the relationship between parent and child is consistently strengthened and deepened, and child functioning improves.
But I think she liked it.
TFC parents are agents of change. Their training provides a crucial framework to inform strategies for handling disruptive behaviors, and that is at the core of TFC's success.
When you have a child and their behavior is escalating and you're trying to calm them down and talk with them while they're angry, that's something that I think that I was not so good at, because when they were really angry, I would still want to engage. We need to talk about your behavior. We need to talk about some modification. And it wasn't the time. What would happen, the child would get really angry. I'm kind of at this point heated, and we wouldn't solve anything. It's just, and I learned from the training that it's okay to have a cooling off spell. It's okay for me to have time out as well as the child.
Parents learn to teach cognitive skills.
And basically, we want to teach kids that your thoughts, feelings, and behaviors are all connected, and that you can control your thoughts. And if you can control your thoughts, then you control your emotions, and then you can control your behaviors.
Looking at thoughts and feelings that precede behaviors can give the child a better sense of self-control and a better understanding of who they are and how they are doing. Helping children to set goals and plan out how to reach them further strengthens thinking skills.
And help them to kind of think about how they're doing. You know, kind of help them do some self-assessment and evaluation of how they're doing at working towards the goals that they want, the things that they want to work towards, their interests, and what are some of the things that get in the way, if there are things getting in the way, and helping them to problem solve.
If it takes a village to raise any child, then children in crisis need assistance from an alliance of adults. Therapists, teachers, school counselors, mentors, case managers, and many others.
Resistant in the beginning, but she's definitely made a lot of progress, and she was happy to see.
TFC agencies train, support, and supervise not only treatment foster parents, but other treatment providers, all working together.
If you have a guardian doing one thing, a case manager doing another thing, and then you and the foster parent doing something else, you're not going to get anywhere with that child because everyone's doing something different.
Regular team meetings ensure that everyone shares expectations about the goals on the child's individualized treatment plan. The biological families are considered an important part of what goes on and are encouraged to be active in the child's placement and treatment.
Right. And so we had...
I didn't do anything. Okay, I skipped.
You skipped.
But it is the working relationship between parent and family consultant, coaching the developing behavioral management skills, that is the key. In therapeutic care, children succeed in remaining in their homes in the community, sometimes up to 10 years. With these longer stays, once aggressive or defiant behaviors get under control, feelings from previous childhood abuse or maltreatment bubble to the surface. These symptoms emerge in the form of post-traumatic stress disorder, extremely disturbing thoughts and feelings sometimes never before experienced. Seeing a need to intervene, researchers in North Carolina further adapted the original model of TFC to include specialized training in trauma-focused therapy.
Do you ever have times when you feel kind of nervous or you're worried or scared or anything like that? Yeah? Well,
As a result, clinicians in participating communities learn cognitive behavioral therapy, or CBT, which has proved effective in a wide range of trauma experiences.
Player, I think, is the one we should try first. This is my little friend. He's a flyer. He likes to fly. Okay? So what I want to do is I want to start...
CBT enables people to cope with the present, to get beyond their traumatic pasts, and to build healthier ideas and a base to move forward emotionally.
Now, one of the cool things about that one is it works like what you said. When you're having to concentrate on what number comes back.
Longer stays in therapeutic foster care have also highlighted a need to help adolescents make a smoother transition to adulthood.
Going to community college first, I buy all that, but I want you to follow through. I don't want you
As
to keep
TFC kids mature, understanding the responsibilities of becoming an adult is increasingly important.
Possibly the location, because me procrastinating, I don't know how the UNC situation's going.
Researchers have encouraged agencies and parents to include planning for the future in discussions with children.
How much time figure out what you're going to need emotionally and what kind of support and what meetings we need to have within the next.
Helping children through the process of figuring out where they want to go in life before placement ends is a crucial final goal in therapeutic care. Research demonstrates that TFC kids get better and show more positive changes than their peers in hospitals or group homes. These gains carry on after the child moves out of the therapeutic home environment. Research also shows cost savings. The children served in TFC would likely end up in much more costly treatment programs, group homes, psychiatric hospitals, or residential treatment centers, if TFC families were not available. Schools, juvenile justice, mental health, and child welfare agencies all collaborating to offer individualized, least restrictive, community-based treatment. This is the ideal formula for providing mental health services to kids. This is TFC.
He's known about a senior project for a year. Josh is my big procrastinator.
The challenge is finding therapeutic parents who are willing to do this job and able to do this job and can hang in there with kids, agencies that can figure out how to provide the level of support that families and kids need to be able to make this work. We really could help a tremendous number of kids.
We're also doing trainings with clinicians that serve the kids that you work with.
Researchers will continue to refine North Carolina's therapeutic foster care approach as children's needs change with longer stays outside institutional settings. Therapeutic foster parents, devoted to caring for children with complex problems, continue to respond to the challenge, improving their care and helping to nurture children.
Everybody has an off day, just like we have our off days, but overall I have to say we got some great kids and we enjoy having them, every one of them so far. It's been good.
I had a good idea of what it was going to be like to be a therapeutic foster parent. I knew it would be very challenging. I knew that I may not get to see the end result, and I just kind of viewed it as I'm planting a garden. I plant seeds, and at some point, hopefully, they're going to grow.
It was a great experience for us, and we love doing it, and I think we'll continue doing it for a long time.